Welcome to the Business Spotlight Series. My name is Donna Kapmeyer, CEO of Action Coach at Coastal Bend in South Texas, and I will be your host for today. I am very excited to have on our show a special guest, Kyle Sinclair. Kyle is the CEO of PAM Health in San Antonio, and today we're going to talk to Kyle about his journey, some of his challenges, some of his successes, and have him share what it's really like to be a CEO. If this is your first time on the channel, please be sure to like and subscribe so you get notifications when we publish new content. Well, Kyle, welcome to the show. It's great to have you on.
Absolutely. Thanks for always having me.
Fantastic. Well, let's go ahead and get started with one of the prominent questions that folks typically ask is kind of tell me a little bit about yourself and how your journey started.
Yeah, I started in healthcare honestly with my mom. My mom's been a nurse for almost 40 plus years, about 40 years, and that's what it started for me. I used to go to the clinics on the weekends to kind of help out filing, and then I just thoroughly enjoyed it healthcare, and so I found a degree that had the business and healthcare together. So it's health administration. And went up to school, finished some undergrad schooling in Houston. That's where I grew up, and then finished my complete undergrad health administration over at Weber State in Ogden, Utah. And then from there, I worked for about 10 years and eventually got my master's of health administration after that. But yeah, I've been, almost 20 years of healthcare experience, both operations, business development, healthcare, post-acute level, or acute level and post-acute level. So been a great career so far.
Fantastic. So I love to ask this question to kind of get going is let's talk about the mistakes. So, having your long history in the healthcare industry, so to speak, what were some of the biggest mistakes that you made along the way of getting to where you are today, and kind of what did you learn from them?
Yeah, I remember almost right after I graduated with my undergrad and taking my first job. And I remember saying to myself, man, they didn't teach me this stuff in school. So, I learned a lot. And I always say, you can do 4 years of schooling or however much, but on the job training is huge and it's invaluable. And I learned more in probably that first year of my undergrad than the entire 4 years of going to school on that. But the journey has been one that I've never been afraid of challenges, issues. I look for them. It's a growing opportunity to get out of my comfort zone and to continue to develop my skill set as a leader and as a healthcare professional. So,
Love that. Love that. So I'm going to hit you with a hard question. Another hard question is you were CEO of healthcare business during the pandemic.
yeah.
So talk a little bit about how you handled that.
That's a once in a lifetime, I hope to God, once in a lifetime type of thing. Definitely once in a century for sure. It was challenging. I think even, I'm a share a story prior to that. I remember when I was looking at my undergrad and asked the CEO of a hospital, "Hey, should I get into healthcare?" And he said, "Yeah, because we need good leaders in healthcare." And I thought that's great. And then all of a sudden, 2020 with the pandemic hits, when the country shut down, when Texas shut down and many cities shut down, I was working 16, 18 hours. And in the very beginning, it was scary. We didn't know what caused it. We didn't know how to stop it, the spread of it. We didn't know how it was transmitting. We didn't know a cure for it, right? So it was a lot of different things like that. It was very scary. What I would say is I came to learn several things. One, I had very great physicians by me. I had critical care intensivist, pulmonologist. I had internal medicine, infection disease. My chief of staff and I were talking regularly. So my physician support and leadership was great, right? As they would learn, I was very firsthand relevant information. Number two, the gear, right? Your what we call PPE, personal protective equipment, the gear that protects you from diseases and illnesses and sicknesses. It was huge, and so having access to that, trusting in your gear and in your training was vital in healthcare. And then ultimately, you had great staff around you, and they protected and took care of the people and the patients around you.
Wow, man. Well, I'm glad that to your point, I hope this is a once in a lifetime thing and that we don't have to deal with it again in the future. So well done with being very locked tight with your crew, with your staff.
Yeah, and
Well
what I
done.
saw is what is interesting during COVID is I saw everything from CDC saying one mask, two masks, three masks, wear a mask, an N95 to wear your face shield, to wear your gowns, to a PAPR suit, to we even had mock shift PAPR suits made by Ford Industry out of
Wow.
DeWalt drill batteries. And they literally made a PAPR suit is what goes over your head and actually creates that barrier and respiratory. You see it in like science movies and scientists. But then it's interesting. I mean, we saw everything intubation boxes to the COVID vaccine to multiple variants of the vaccine. So it's kind of interesting.
Wow. Crazy times, crazy times. So let's talk about, kind of where you're headed. Where do you see things going for PAM, and what kind of aspirations do you have for PAM Health over the course of the next 5 years?
Yeah, I mean, I think PAM Health is a large organization, third largest post-acute provider in the nation with 80 hospitals across the United States. I'm the CEO of one of our hospitals here in San Antonio. I think we do a great job. We provide a wonderful service of patients, of rehab services to patients in the city of San Antonio. And you're talking hundreds, if not thousands of patients every single year that come through our hospitals and provide a service. Look, what's interesting about rehab services in the healthcare spectrum, you've got to look at the totality of healthcare in America. You have the biggest hospitals, right? In San Antonio, it's Baptist, Methodist, Christus University, Brooke Army Medical Center, and then everything else kind of goes from there. And then you start getting into your long-term acute care hospitals, your rehab hospitals, and then you get into your facilities, your skilled nursing, assisted living, and independent living facilities. And there you start getting into your community-based home health, and then ultimately to hospice, which is where you have patients. That's what we offer patients in America. And what I find fascinating about rehab, there is no setting in what I just shared that you get one-on-one care except for rehab facilities. That's it. The Medicare dollars and the biggest payer does not reimburse short-term, long-term, or a skilled nursing facility, assisted living, home health. They don't get reimbursed to provide one-on-one rehab services. The only place you get that in the entire American healthcare system is in inpatient rehab settings. And so it's amazing to see patients literally rolling in on stretchers in about 10 to 14 days. The majority, if not a lot of them, are able to literally walk out on their own. And it's amazing to be able to see the progress of level of care at this level of care.
Wow, that is fascinating. And I never thought about that, but that's it. That's interesting how that really is. And if you think about the services you provide and your competitors that are doing the same thing, what do you think differentiates you from the others?
Yeah, I think that's a great question. I think innovation from technology services, we have what's called an exoskeleton machine system, which actually provides support and stability for stroke patients. We're one of two in the entire city of San Antonio. I think our disease specific certifications, which means we've gone to extra certification to be trained and specialized on stroke, spinal cord, congestive heart failure, and brain injury. So we get very specialized in some of those. And then it's our program development, working closely with our medical staff. We have everything from Parkinson's patients that we deal with Parkinson's physician oversight to amputations, both pre and post amputation, as well as prosthetic training. We also have transplant patients that we see with transplant physician oversight. So I think the high level of care that we've placed into the training into our staff at the floor level, which is nurses and therapists, and then physician oversight is a huge differentiator from what we do amongst our competitors. We have gone heavy into the quality programs, quality outcomes, and we're grateful to be able to provide that service in the city of San Antonio.
Fantastic. Fascinating. Fascinating. So let's look, I'll say let's fast forward. What excites you about the future of this industry and the business that you're in?
Yeah, I think that the service itself is a great service. I think the big talk right now is cuts across the board from a federal standpoint. A lot of hospitals, insurances, healthcare systems are all looking at the federal dollar and the cuts that are being told that are coming down in 2025. So you're expected to do more with less, which doesn't help. But I'm extremely excited where Pam Health has put themselves. The owner of our company has done a phenomenal job on established himself as one of the leading experts in the service lines that we offer, and has done a great job in this community to become the number one provider. Look, we have been voted number one rehab in the city of San Antonio for 3 straight years by physicians. And our physicians love practicing here. The physicians love sending their patients here, and ultimately our patients love attending here. Now we're not perfect. We strive for perfection, and we work very hard at our outcomes to make sure. But I think being set up for success for some of the ventures that are going to happen in 2025, change in administration always bring change. Let's see if healthcare is a top priority for the Trump administration. But I think the owner of our company has done a phenomenal job on leading this company in the future, where we're poised to be.
Oh, fantastic. And congratulations as well.
Thank you.
On a personal level, when you think about success, who is the first person you think of and why?
Yeah, I think that's a great question. I think on variant fronts, depending on healthcare, I love what, again, I shared the owner of our company's done a phenomenal job on taking this company. One of the only few single owner companies. The rest of them are publicly traded or private equity. He's a single owner that's done a phenomenal job with great outcomes and continues to grow and innovate. So I love that. That's a great one. I have a lot of mentors that on many fronts, on varying subject matters that I find interesting and curious to me. There's a professor out of UIW that I'm very good friends with, that we talk regular about innovative stuff that's happening in healthcare. So I think just pushing. I talk regular to CEOs here in San Antonio. The Methodist Health System. I was just texting with one yesterday. I think you got to continue to push and develop and continue to make sure you're mentor and growing. And that's for me has always been a great success and why I've been successful in my career is learning from other people.
Love that. Love that. Absolutely. Now, if you could do it all over again, would you do anything differently?
Oh, that's a tough question. I would say yes and no. I think the no being healthcare is a tough industry. I think with just like every other industry, but healthcare is a calling, it's a passion. I shared that, again, I grew up on healthcare. There's other interests of mine. Sure, yeah, there's things I love to death and would do. I think healthcare law is an interesting one, so maybe the legal route. I think healthcare policy is an interesting one, so maybe that route. I think healthcare in general is great, but there's great industries across the board. What I find fascinating about this question, that kind of leads to it, is we all come into this world touching healthcare. We all leave this world touching healthcare, but healthcare is never a top three priority ever. It never is, and it probably never will be. Crime, security, economy, those are big topics that everybody talks about, but we don't really focus on healthcare change. And I think that's what I find kind of fascinating. But answer your question, probably it's been a great career. I don't regret it. I've had a lot of success. I've had a lot of fortune of taking care of, working with great people, great organizations. And ultimately, I keep saying, when you do healthcare correctly, which is business and healthcare itself, the quality side of it, that you can do great things for a community. So I've been a pleasure of being involved in many great things on that level.
Fantastic. Fantastic. Well, what is the best way for our audience members to learn more about you and Pam Health?
Yeah, I think Pam Health is, you can go to our website at pamhealth.com. It's a great organization. Again, we're growing. We're 80 hospitals across 17 states and provide 3 service lines across the United States, and about to probably be the 3rd largest post-acute provider in the nation. So definitely go to the website. Myself, I'm all over social media, LinkedIn to social media such as Facebook and Twitter. And you'll see a lot of following stuff on me there. But LinkedIn's a big one for me. Healthcare, as well as other current topics that I talk about and have an interest and passion in, and try to bring not relevant information, as well as my spin on things that I'm seeing across this nation.
Fantastic. That's fantastic. Well, thank you, Kyle, for sharing your story. It's been very insightful. I hope our audience really takes and values what you've said, because I surely have. So thanks for sharing your story. This is the Business Spotlight series with Donna Kapmeyer from Action Coach at Coastal Bend and our special guest, Kyle Sinclair of Pam Health. Please be sure to like and subscribe so you can continue to see our great content. And thank you for being with us today. We appreciate your time.
Thank you.